want to bring in Dr. Frita.
RFK Jr. is not a doctor. He's not a nurse. He's not a physician's assistant. We are unprotected as far as health. I fully understand the people who resigned. But now that we have lost so much brain power, so many people who study the evidence, study immunization, study infectious disease, we know that very likely they're going to be replaced by yes men and women, people who will sit up, who will lie with impunity. It's going to affect the proper studying of diseases. It's going to have misinformation, and ultimately it's going to cause us to lose lives in the United States. This is very serious.
We're going to have someone on to talk about the CDC now. I want to bring in Dr. Frita, who is with us. Dr. Frita joined us the other day to discuss the president's possible health issues or what the diagnosis would be. She's a triple board certified medical doctor with certifications in nephrology, hypertension, and diabetes. She's also the host of the Dr. Frita YouTube channel. Doctor, thanks for joining us once again. How are you?
Doing well, not real happy about all of the headlines.
Oh my gosh, yes, I know, none of us. So I want to get into this and discuss what's happening at the CDC. I'll read a little bit of the headlines, doctor, and then I'll bring you in to get your response. But the Centers for Disease Control Prevention leadership was in stunning disarray. It happened last night after the Trump administration fired the agency's director hours after she refused to resign under pressure. The director is Susan Monarez. Said that she was resisting being ousted by the nation's top health official, Robert Kennedy Jr., for political reasons after about a month in office. Quote, when the CDC director, Susan Monarez, refused to rubber stamp unscientific, reckless directives and fire dedicated health experts, she chose protecting the public over serving a political agenda. For that, she has been targeted. That's what her lawyers said. Mark Zaid and Abby Lowell. Caroline Levitt responded to it in a press conference. Here she is.
The secretary asked her to resign. She said she would, and then she said she wouldn't. So the president fired her, which he has every right to do. It was President Trump who was overwhelmingly reelected on November 5th. This woman has never received a vote in her life, and the president has the authority to fire those who are not aligned with his mission. A new replacement will be announced by either the president or the secretary very soon. And the president and Secretary Kennedy are committed to restoring trust and transparency and credibility to the CDC by ensuring their leadership and their decisions are more public-facing, more accountable, strengthening our public health system, and restoring it to its core mission of protecting Americans from communicable diseases, investing in innovation to prevent, detect, and respond to future threats. That's the mission of the CDC, and we're going to make sure that folks that are in positions of leadership there are aligned with that mission.
Dr. Frita, I saw you shaking your head when she said, make America healthy again. What do you think?
Don, my blood is just boiling. RFK Jr. showed us exactly who he was before he ever was placed at the head of the HHS. Throughout that Senate hearing, Senator Brooks, for example, just went back and documented all of his decades of misinformation. And I can't believe that she's able to sit up there and say that he's trying to decrease communicable diseases. Let's talk about one of the most deadly diseases, measles. We thought that we eradicated measles back in 2000. Why? Because of the effectiveness of the vaccines. RFK Jr. has been out with misinformation actively, as well as before being placed into his position. And now we've had the highest number of cases of measles in over 30 years. And where? Largely in West Texas, where they're touting their Make Texas Healthy Again. We've had deaths, at least 2 deaths from elementary age children who were unvaccinated in Texas. He is doing the opposite of decreasing communicable diseases. RFK Jr. is not a doctor. He's not a nurse. He's not a physician's assistant. He in no way has the authority to be in that position. And now that we are losing scientists, and he's already trying to defund or restrict COVID-19 vaccines, among others, he's putting out misinformation about autism. It feels like a dystopian novel. I just can't believe that as a person who was trained in evidence-based medicine, that we're all sitting around. And for the people who are sitting back complicit in Washington, including those who voted RFK Jr. in, they will have to pay either just with their conscience. I just don't know how this is happening. I'm mad, Don.
Yeah, well, I'm glad you're here because I think a lot of folks are frustrated. This all sparked a near immediate leadership exodus from the CDC, institutional knowledge, brain drain. And the CDC is charged with safekeeping the public health. of more than 300 million people in the United States, at least 4 top officials announced their resignations. What does that mean for the health of this country, for keeping records about health, for getting accurate information about health, and for people who are looking out on our behalf, for our best interests?
It means that we are unprotected as far as health. I fully understand the people who resigned, okay? And I certainly support Susan Monterez for saying that she wasn't going to resign. She was going to wait until they had to just officially fire her. But now that we have lost so much brain power, so many people who study the evidence, study immunization, study infectious disease, we know that very likely they're going to be replaced by yes men and women, people who will sit up, who will lie with impunity. And what this is going to do, it's going to affect our vaccines. It's going to affect the proper studying of diseases. It's going to have misinformation. And ultimately, it's going to cause us to lose lives in the United States. This is very serious.
Do you believe that RFK Jr. is the most dangerous member of the Trump cabinet?
From my perspective, as a physician who is evidence-based, as someone who's board certified in nephrology, internal medicine, obesity medicine, I have watched him and listened to him share his misinformation. And yes, he's the most dangerous, because not only is it just the things that we see on surface, like the measles vaccine, he's put out information saying that Black people should receive less vaccines than white people. And when he sat up there and tried to quote the study, he quoted Dr. Poland. Oh, I'm very familiar with Dr. Poland. He outright lied. What do you do when someone who's at the leadership lies? And then he's also tried to put a block on COVID-19 vaccines, and that was back in 2021. He's also talked about, he shares misinformation about obesity medications. He said that those GLP-1 agonists were being used first line in people who were 6 years of age. It's absolutely untrue. And you know, oftentimes when someone has an argument, it's like a different perspective or a different opinion or a different view. With him, outright lies. The thing is, his lies are affecting the health of people. So he does say certain things that are kind of largely common sense. Oh, we need to increase our nutrition. Okay, yes, we do. But we also need to cut back on the misinformation that's oftentimes race-based. I look at him and he's someone who is just so far off base that I don't even think that he's based in reality. You've probably seen his sister on different interviews saying, she's like, I love my brother. He shouldn't be there. I'm really looking at the people who have been elected to make decisions, the ones who actually voted him in. They knew better. They knew better. But here we are. And just because they are scared of, what's going to happen to them politically, they're now putting everyone's lives at risk. I can only imagine the people who are going to replace those in the CDC. I highly doubt these will be people who respect evidence.
I want to ask you of something about what Sam Stein said. Sam Stein, one of our friends over at the Bulwark podcast. I don't know if have you seen the Bulwark?
I've seen them come on your show. Some folks
yes.
like Miller.
Well, they reported today that in the next month or two, RFK Jr. will formally declare that vaccines cause autism. Vaccines cause autism and should be banned. What's your reaction to that? If that reporting is indeed true. Okay.
RFK Jr. has quoted this one study from 1998 that was published in The Lancet that declared that the MMR vaccine specifically was associated with autism. That study had 12 children. Ultimately, of all of the authors, everyone came back and they admitted that there was fraud, that there was misinformation, and all except for one person who was actually found to have fraud. And so that's 1998. The Lancet actually withdrew that study and said, you know what, we have no evidence. Since then, hundreds of thousands of children have been studied on multiple continents, and there has been no cause and effect of vaccines and autism. It's absolutely untrue. And so if he declares that vaccines cause autism, then what's going to happen? We'll have decreased vaccines. And so let's take a look at life. We often wonder why some people who are very anti-vax, why aren't they afraid of a world without vaccines? The same reason people aren't afraid of the boogeyman. They haven't seen the effects. They haven't seen the diseases. Life before the measles vaccine, almost every child got the measles, okay? And they not only could they die from the measles, but they could get encephalitis, vision loss, blindness, polio. before the polio vaccine. And I talked to my parents who were in their 70s. It was very common to have people who were paralyzed or who died from polio. Smallpox used to kill almost 80% of the kids it infected. So we sit here in this world, oh yeah, let's get rid of vaccines. But people don't know what the world was before vaccines. And as long as we have people who are whitewashing history and not sharing the facts, then they won't know until it hits home. He must be stopped. And this should not be a right or a left thing. It should be bipartisan. Let's look at the evidence. Let's look at facts. We can argue about other things, that can be bipartisan. But when it comes to the lives of people in this country, everyone needs to wake up.
Dr. Frita, the host of the Dr. Frita Show, and also the author of Under Pressure, I see behind you on the shelf. Doctor, do you have a minute to take some questions from some of our viewers?
I do. And I also want to share, I'm also on @truthtalks-live with Teray, with Dr. Bryant, where it's like the TMZ of the culture, where we really get into all of the truth from medicine and
Teray, he ain't nobody.
Oh, he is. Listen, I love him.
I'm kidding.
They get into the business on that show Truth Talks. He has to fight for his life. It's so good.
I want to come on as a guest. I'd love to have me on.
Yeah, absolutely.
I know Jody, right?
Yes. She's wonderful. Truth Talks-live is 8 p.m. Eastern Standard Time. And you know what? I'll be honest. It's hard when you're a man. All the ladies give you a hard time. So you have to be ready. Have your boxing gloves on when you come down.
I'm ready. But will you take a couple questions from our viewers?
Sure. Hi.